And welcome back to This and That as the doctor is in. Dr. Josh Alpers, who is a neuromuscular physician with UT Erlanger Neurology Clinic here. And the topic is basically what is neuromuscular medicine and some of the disorders that are out there. Now, in many cases, that's hereditary, and there are a lot of families that unfortunately have to deal with this. But then also, too, when it comes to things like carpal tunnel syndrome and other ailments that are out there, give us a little bit of an explanation of what it is.
Okay, so most of the time when you think of neurology, you think of disorders that affect the brain and the spinal cord, things like stroke, migraines, epilepsy. Neuromuscular medicine encompasses the peripheral nervous system, so the nerves and the muscles, not the brain and the spinal cord. Disorders that are common that are affected include things like ALS or Lou Gehrig's disease. The overwhelmingly most common are going to be more benign conditions such as carpal tunnel syndrome, pinched nerve of the elbow, pinched nerve in the neck or the lower back. And then disorders of the muscles and where the nerve meets the muscle, such as myasthenia gravis.
Now, when you're talking about affecting different parts of your body, you're talking about really the muscles that we use, the muscles that we control, arm movement, leg movement, things like that, to where we use every single day. Obviously, we use our muscles, all of our muscles, but when you're sort of breaking it down. Now, there are a lot of us that are out there, especially that might have some twitching, might have some, uncontrolled movements of some of their arms or fingers or things like that. When is it a time that we need to be concerned or call you?
It's a good question. And the symptoms themselves for neuromuscular disorders can be somewhat vague. A little bit of tingling here and there, some twitching, a little bit of weakness, some cramping. A good rule of thumb is if it's persistent for several days, and especially if it's bothersome to you, you need to talk to your doctor and then get pointed in my direction.
Now, lots of times they come in for sort of a consultation, but what does all that involve?
Anytime I see a patient, regardless of the capacity that I see them in, I will do an interview. I will examine the patients, and the vast majority of patients I see I'll perform electrodiagnostic testing on. And what that is, I'm looking at the electrical properties of the nerves and the muscles. And it gives me a fair amount of information on if there's a problem, how long it's existed, if it's healing, and then the outcome of any consultation is to find a way to get you better.
Now, unfortunately, when it comes to some of the disorders or some of the ailments that we have, when it concerns neuromuscular, there are diseases, there are effects that don't have cures for them, but research continues. Where are we there when you think of Lou Gehrig's or ALS, things like that? Where are we with some of that research, and where do you think we might be maybe in 10 years from now?
It's hard to say. We're going to see a lot of changes in the next couple of decades, specifically in regards to muscular dystrophy and ALS. These are areas of very active research. Unfortunately, at this time, the vast majority of what we do is supportive. It's providing comfort. It's making sure that patients have access to everything they need access to and that they retain the functional capacity that they have as long as possible.
Now, of course, you can diagnose, and sometimes you give the good news where you're misdiagnosed, but afterwards, they're still coming to you even for comfort as your body progresses.
Correct. And for the chronic and the untreatable disorders, it's symptomatic treatment. We wait and see what happens and then try to minimize the symptoms that you have and try to maximize, again, the function that you have as the disease progresses. And like you said, the best thing that I can do, too, is to re-examine the diagnosis. There's nothing better than being wrong about a diagnosis of ALS.
And the best thing about being a doctor is that you have all the answers, or most of the answers to the questions that are out there. And of course, if you do have some questions when it does concern your nerves and especially neuromuscular ailments out there, please do give them a call. It is Dr. Josh Alpers. He is a neuromuscular physician with UT Erlanger Neurology. The phone number, 778-DOCS. Very easy to remember, 423-778-DOCS. And of course, if you just have general information and looking for general questions, just about anything, of course, Erlanger, they are the pros. It is Erlanger Medical Center. 778-LINK is the phone number for general information, or of course, you can always go on their website at erlanger.org. And Doctor, we certainly appreciate you stopping by.
Thank you very much.
All right, folks, we're going to switch gears here, and if you love good old